It's really my pleasure, one, to welcome such a great big group. This is tremendous. And if you guys want to come up a little closer, that's fine. We'd welcome you to do that. Well, I'd like to welcome you all to Salisbury University. My name is Karen Olmsted, and I have the privilege of serving as interim provost and senior vice president of academic affairs here at SU. And it's my pleasure not only to welcome you to campus, but to also be part of this important announcement that we're making on behalf of our president, Dr. Janet Dudley Eschbach. Dr. Janet is actually in South America right now working on agreements with Colombian universities that we'll be collaborating with, SU and these Colombian institutions. But she felt that this was such an important announcement that she wanted us to go ahead and make it without delay. So for context, it's no surprise that healthcare and social service programs are growing in importance for the well-being of the citizens of our region, of our state, of our nation, and also to our economy, certainly. Salisbury University has a rich collection of academic offerings in these areas, but currently we don't have an organizational structure that really allows you to get a handle on all the things that we do offer. For example, our nursing, medical lab science, applied health physiology, and respiratory care programs are housed in the Henson School of Science and Technology, while athletic training, exercise science, community health, and our social work programs and our fitness and wellness course are housed in the Seidel School of Education and Professional Studies. So it makes it difficult with our current structure for important external audiences like prospective students or healthcare organizations, we have several folks here today, or social services agencies, funding agencies, the press certainly, and others to quickly identify the scope of our programs and a point person for them, all these healthcare and social services related programs. Similarly, it can be hard sometimes for even faculty and students on our own campus, we have several students here today, to identify opportunities for collaboration because they're in programs that are in different schools, operating under different deans, and sometimes with duplication of effort and resources. So given the societal importance of and workforce demands for healthcare and human services related graduates, there was strong support across campus to restructure these programs under a single umbrella or administrative unit. And that's what we're going to be talking about today. And that will better coalesce leadership, research, and services and facilities in support of these programs. After much discussion and planning, and by approval of the University System of Maryland Board of Regents, we're delighted to announce today that Salisbury University is creating a new college, the College of Health and Human Services. In addition to our students and faculty, this new college will positively impact the greater community and certainly the workforce needs across the state. Set to launch this fall semester, the College of Health and Human Services, or the CHHS as we're calling it, will actually be the largest academic unit on our campus with about 2,200 students. And it will house 3 different schools: School of Nursing, School of Social Work, and the School of Health Sciences. In addition, I'm pleased to announce today, to my right, that Dr. Kelly Fiala will take the helm as the transitional dean of the CHHS, and she brings expertise in academic leadership. She's most recently served as interim dean of the Seidel School of Education and Professional Studies, and also as the program director of our athletic training program. So Dr. Fiala will be up in a second to tell you a little bit more about each of the 3 schools that will be in the college. I'd like to also recognize in front of me today several important community partners that have joined us, and we really appreciate their support in being here. From PRMC, Steve Leonard, who's the President and CEO of Peninsula Medical Health System, and also Chris Haar, who's the VP for Strategy and Marketing. Thank you for being here. Penny Short is here from Nanticoke Health Services. Thank you for joining us, driving down. Lori Brewster from Wicomico County Health Department. We know that you're very busy, especially in flu season. Appreciate you being here. And then Bunky Luffman's also here from the governor's office. So thank you all for being here today. We really appreciate you taking the time and all your support. The organizations that these folks represent and many others have been longstanding partners of the university and provide opportunities to our students and hire our graduates. And we look forward to expanded collaboration with all of you through the new college. The dramatic restructuring of academic programs into this single unit of the College of Health and Human Services reflects the growing importance of healthcare and human services as I said, in our state, nation, and certainly in the economy. If you think about things like the opioid and other substance abuse epidemics, diabetes, obesity, the rapidly aging boomer generation, and our distinct rural healthcare needs, we think that the college will bring a lot to bear on that. According to Politico, the healthcare industry is on pace to become the largest job sector within the next 3 years. And the country has experienced nursing shortages, as many of us know, for a long time now, but those needs are expected to become even more acute. A statistic that I think puts much of this in context is that on average, 10,000 people in the United States turn 65 every day. That to me just kind of captures a lot of issues. And according to Grayshore, which is an arm of Beacon, I know Memo Derricker I saw, he's in the back there, our Business Economic and Community Outreach Network, they did a study and they found that the Eastern Shore is aging faster than the rest of Maryland. With 2/3 of Medicare recipients suffering from multiple chronic conditions, the demand certainly for health care, nursing, and other health care and social services will certainly soar. In addition to helping produce more graduates to meet these needs, reorganizing these programs into a single unit we think will increase operational efficiency, and that's a goal for us certainly and for the University System of Maryland. And many of these programs, as you might guess, share similar teaching methods, they share prerequisite courses and facility needs, like our Henson Medical Simulation Center. We have staff from our Henson Simulation Center here today, as well as they share accreditation, student credentialing, and other administrative responsibilities. So things like affiliation agreements with many of the organizations here today, background checks, vaccination checks, and then expectations for student behavior, student conduct in the clinical, professional settings, community health settings, and the like. In addition, and this is really key, I think, a key driver for forming the College of Health and Human Services, the establishment of the CHHS reflects the growing need for interprofessional collaboration among healthcare, behavioral health, and social services professionals. For example, if you think of a young athlete who has a concussion, maybe a middle schooler or a high school student, there's certainly going to be physicians or advanced practice professionals, nurses and technical staff, maybe in the clinic they're going to tend to that young person, but also social workers might be assisting the family, the athletic trainer back at their home school, school nurses, and several others that might be involved in their care, as well as the family. Similarly, for older individuals suffering from multiple chronic conditions, you can think of their care teams involving physicians, hospitalists, nurses, respiratory therapists, social workers, occupational therapists, speech therapists, physical therapists, pharmacists, the list goes on in terms of the care that surrounds those people. There are just many, many people involved. And our students in the programs that we have work in hospitals and agencies and many other settings where they have the opportunity to work with several other professionals. Indeed, we're leveraging many strong connections forming among not just the programs on our campus, but also with programs, healthcare programs at the University of Maryland Eastern Shore through the Eastern Shore Collaborative for Interprofessional Education, which is a faculty-driven initiative, really initiated, I think, by Bob Joyner, and Bob is here as well, and was established more than 5 years ago, and that's a very active collaborative that provides a lot of exposure to many students. A critical report from what was formerly the Institute of Medicine stated that health professionals should be educated to deliver patient-centered care as members of an interdisciplinary team, and patients receive safer, higher quality care when healthcare professionals work effectively in a team, communicate productively, and understand each other's roles. And similarly, the World Health Organization also applauds healthcare professionals learning about, from, and with each other, and adds that interprofessional collaboration and teamwork can best be achieved if it starts early with students from different programs, as we'll have in the college, engaging interactively with each other. And certainly the CHHS is going to allow us to do that a lot more effectively. Currently, our outstanding graduates are employed across the country at organizations like Mass General in Boston, University of Washington Medical Center in Seattle, Dartmouth Hitchcock Medical Center, Children's Hospital in Philadelphia, and then closer to home at Johns Hopkins, University of Maryland Medical Center, and then obviously PRMC, Atlantic General, Nanticoke Memorial Hospital, and scores of agencies that provide counseling, advocacy, and support of child welfare, mental health, and for persons with challenges associated with disabilities, substance abuse, aging. With the HHS, the opportunities it provides, we expect our graduates to be in even more demand. I mentioned that President Dudley Eschbach is out of the country working on these international agreements, but upon her return to the United States, she'll be meeting with donors in hopes of securing a private gift, naming gift for the college. She doesn't like the fact that it doesn't have a name, like our other schools do. So she'll be working hard on that because we have enjoyed so much support from benefactors in the naming of our other schools. So many other opportunities exist for philanthropy, and we have our foundation people are here today, not surprisingly, because of their interest in that. And before I bring Kelly up to the stages, these aren't scripted remarks, but I just want to say there are a lot of people here, as you might guess, from healthcare agencies. We have students, we have the press, obviously, we have a lot of faculty here, but we also have a lot of people here from behind the scenes, like the registrar's office, for example, because making this kind of shift across an organization takes so much work. We really appreciate all the people that work behind the scenes to make this happen. And now it's my pleasure to introduce Dr. Fiala, who will be the transitional dean of the College of Health and Human Services, so she can tell you more about each of the schools within it. Oops.
Thanks, Provost Olmsted. I'm honored to be here today to represent the new College of Health and Human Services. As was mentioned, the new college is composed of 3 schools. I'd like to take a moment to share some highlights of the schools and also recognize the directors who are in the audience today. Dr. Robert Joyner will lead the School of Health Sciences. Dr. Joyner, currently an Associate Dean of the Henson School and also the Respiratory Therapy Program Director. In the second row here. Dr. Jeffrey Willey, current Nursing Department Chair, will lead the School of Nursing. And next to him is Dr. Deborah Matthews, current Social Work Department Chair. She'll lead the Social Work School. The School of Health Sciences. The School of Health Sciences, and you'll see it here on the third board, will contain 4 undergraduate majors. That's respiratory therapy, medical lab sciences, exercise science, and community health. Community health is currently seeking initial accreditation from the Council on Education of Public Health, which will make all 4 accredited bachelor's degree programs. The school will also house 2 accredited graduate programs, athletic training and applied health physiology, and the university's graduate general education fitness and wellness program. In addition, the school faculty are also offering the exercise science program at our university's at Shady Grove campus, and we have plans to bring our applied health physiology program there as well. For all of the programs in the school, certification and licensure exam passing rates are above the national average, and job placement rates are extremely high. In addition, active student clubs participate in community outreach and professional organization conferences and quiz bowls. And we've won a few of those. The School of Nursing's academic offerings include the bachelor's and master's degree, as well as the university's first doctoral degree, a Doctor of Nursing Practice, which started in 2012. The Maryland Board of Nursing ranks SU as having the highest 10-year average pass rate of all USM institutions on the National Council licensure examination for registered nurses. Most recently, the university topped the list of all BS and BSN granting programs in the state. In addition, nursing faculty are highly active in the development of clinical faculty, and have been awarded millions in grants to support these initiatives. Last but not least, the School of Social Work. The School of Social Work will offer students opportunities for Bachelor's of Arts in Social Work and Master's in Social Work degrees. The faculty provide this program on main campus, as well as 4 regional higher education centers in Maryland, and through a partnership with UC to military personnel and their dependents stationed in Germany. Recently, the program added a fully online MSW. And the thing about the MSW degree is it is our largest enrolled graduate program on SU's campus with nearly 400 students. In addition to degree offerings, the social work grant-supported community outreach programs include training through the Child and Adolescent Behavioral Health Education Initiative. They're always tongue twisters, which enables professionals from multiple disciplines to aid with the mental health and resiliency of children and adolescents in rural locales. And then we've also added Hope Corps this last year, which strengthens community organizations working to tackle the opioid epidemic in Maryland. As you can see, the opportunities related to bringing these programs together are numerous. In addition to enhanced recruiting of students and faculty due to the visibility of the health and human service programs, we'll be able to expand educational and research opportunities for students, faculty, and our local practitioners. Collaborations through service projects, volunteer experiences, and research studies will increase. Realignment has the potential to improve grant prospects and allow for partnerships in the delivery of continuing education to our local healthcare providers. Finally, program faculty will be able to evaluate possibilities to offer cross-listed courses, co-taught courses, multidisciplinary programs, minors, and tracks. So in the upcoming months, we're going to be pretty busy. The college faculty will be working closely with the school directors and me to finalize the support structure and formulate strategic goals. We are extremely excited to kick off the next academic year with the new College of Health and Human Services. Thank you all for coming. Please enjoy refreshments that are located in the back. At this time, Provost Olmsted and I will be happy to speak with the media, and we invite our community partners to do so as well. Thank you.
And I'll also mention we have nursing students and respiratory care students in the third row, and a couple nursing students in the maroon in the third row if anyone's interested in asking them. And also in that row is our staff from our simulation center. So.